Hi guys, my name's Katherine. I'm one of the tutors here at Chegg. I typically tutor science, math, English, and Spanish. And today we're going to be talking about a scientific topic, which is autism spectrum disorders. So, something that you may not have known is that autism is not just one cut and dried disorder, it's actually on a spectrum based on the severity of the disorders. And just like any spectrum, there's, an infinite number of points on that spectrum, but we're going to be talking about some of the more notable points. So let's just talk first about autistic disorder. So that's typically what people are thinking about when they think of autism. So people with autistic disorder have impaired social interactions. They may have trouble picking up on things like if someone is being sarcastic, whether or not to enter into a conversation. They may become fixated on certain topics and have trouble getting off of that topic, even if other people are giving social cues that they're not very interested. People with autism could also have impaired communication. This is different than impaired social interaction. For example, some people with autism are nonverbal. They won't speak at all, or they'll speak very, very little. So this, in that case, impaired social interaction might look something like being unable to look people in the eye, but also not being able to speak. People with autism can also exhibit restricted repetitive behaviors, for example, rocking back and forth, shaking their head back and forth, maybe clapping or snapping, something like that. And we're not quite sure why, but that's considered relatively severe, especially if the person is nonverbal. But just like everything else, it is a spectrum. Let's skip over Rett syndrome for a second. So Asperger's is seen as a much less severe form of autism. So people with Asperger's may still have or will still have impaired social interactions. They may have trouble picking up on social cues, sarcasm, that sort of thing, but they are able to speak, and in fact it often shows up that they're quite brilliant. The same with people with autism, but that can be harder to tell if they're unable to speak at all. But people with Asperger's are often incredibly bright. Some of them are what are called savants, where they have a almost superhuman ability to perhaps do math or to remember dates or facts or something like that. But that's also where the fixating on one topic can play in. For example, somebody with Asperger's may be really, really good at remembering everything there is to know about all of the United States presidents, but it's also difficult to get them off of that topic when people aren't as interested. They can also exhibit restricted repetitive behaviors, may also have trouble looking people in the eye, that sort of thing, but that's seen as much less severe. We also have pervasive developmental disorder, NOS, which stands for not otherwise specified. So this is a person who has impaired social interaction and or impaired communication and or restricted repetitive behaviors, but for one reason or another is not going to fit the diagnostic qualities for autism or for Asperger's. Because, as you might have guessed, we're somewhat simplifying these here. This is what's typically seen in Asperger's or autism, but it is a little bit more detailed than that when we're talking about giving a diagnosis. So the reason that we skipped over Rett syndrome is that it's not a typical type of autism. It actually only affects girls, and we know what causes it. It is caused by one of the two X chromosomes being entirely deficient. Men cannot get it because they have one X and one Y, and without that X, they can't survive past, probably a couple months after conception. Women, on the other hand, with two X chromosomes are able to survive, but they are pretty severely disabled. So girls with Rett syndrome will usually start to develop pretty typically, but then they'll have some developmental stagnation around about a year and a half old. So they'll have a very small head, very large hands, and they'll start to not keep up with their peers on the growth charts, and then they'll also stop being able to keep up with their peers on developmental charts as well. So even though these girls often have learned to speak and have learned pretty good motor control, they'll actually start to lose that, and they'll have a bit of an autistic regression. They may become nonverbal. They may now have trouble looking people in the eye. They may start, restricted repetitive behaviors as well. A couple years later, probably around 3 or 4, they start to get seizures and scoliosis as well. Around 10 years old, you'll see a decrease or complete loss of mobility. Sometimes they'll keep that up until around 20, and then you'll start to see some Parkinsonian features around 20 years old, meaning that there's some cognitive issues, but they'll also have trouble with movement. This plays in to the loss of mobility. So this is obviously a pretty grim diagnosis, and we're still working on a lot of treatments for that. So, like I mentioned, we know what causes Rett syndrome, but we're actually not 100% sure about all of the things that play into autism. So the cause is roughly what's considered 58% unknown. There has been an increase in diagnoses in autism recently, but most of that seems to play into things like increased parental age, which is a risk factor for autism, increased knowledge of physicians to be able to diagnose, increased, there's something called, spatial clustering, which can also lead to an increase in cases. Also, as laws are passed that allow people with disabilities to live more fulfilling lives, it's possible that that is decreasing the stigma and allowing more diagnoses to come forward. So what we do know is that autism currently affects or is currently diagnosed in about 1 of 62 children, and it is more common in boys, being diagnosed in about 1 out of every 48 boys. Like I mentioned before, increased parental age leads to an increased chance that your children will have autism, but genetics also plays a pretty big role. So if your identical twin has autism, there's a 77% chance that you'll have it as well. If your fraternal twin has it, there's a 31% chance. And if your sibling has it, there's a 20% chance that you'll have it. Something that we do know is that autism is not caused by the measles vaccine or any other vaccine. All of the studies that have been done to try to recreate the one study that did suggest that have not been able to show it. That doctor himself actually rescinded his paper. I think one of the reasons that belief is super common is something that we talked about briefly here, autistic regression. So sometimes parents will see their children who were developing typically seem to regress a little bit, and they'll kind of connect that with the vaccine. So it might seem that way at first, but all of the studies have shown that it is perfectly safe to vaccinate your children, and that has absolutely no effect on autism. So that should do it for an overview of what is autism and the autism spectrum disorders. I hope you enjoyed this video, and if you have any questions, please feel free to contact me for private tutoring on Chegg.